A motor skill can be classified as a behavior achieved primarily through coordination of limbs and brought by the muscles. A basketball free throw can therefore be classified as a motor skill. When classifying the skill of a basketball free throw using the 1D motor control classification, it is evident that it is a gross motor, closed, and discrete skill. According to Gentile's taxonomy, the skill of shooting a free throw is classified as 1B. This is due to the closed nature of the skill with no intertrial variability combined with the manipulation of the object and not the body. The skill of a free throw can be broken down into a sequence of essential elements. 1. Feet shoulder width apart with the dominant foot slightly rotated to the non-dominant side. 2. Knee slightly bent in a balanced position. 3. Ball on your fingertips of the dominant hand with the non-dominant hand resting. 4. Elbow in an L shape pointing towards the target. 5. Transfer the body weight from the feet up the body. 6. As you do this, bring the ball up to the line of sight of the hoop. 7. Shoot the ball predominantly using your thumb. 8. Follow through. Measuring performance can be broken down into two parts: outcome measures and production measures. The quality of movement can be measured by comparing the sequence of the movement to the list of essential components previously mentioned in the skills analysis section. The outcome measures will be measured using the following point scale when attempting 10 shots at the basket. This will be measured at the start of the 5-week program and also at the end.
Can't be touched, can't be stopped, can't be moved, can't be rocked, can't be shook. We hot. When will you niggas learn? Came to get crunk, came to bring life, came to get started, came to get right. Turn down the music, turn up my mic.
When distributing training, there are two different types of practice. Mass practice is where there is a relatively large amount of time in the physical activity practice and the engagement of the skill with little rest time involved. Distributed practice involves rest time that is typically a lot longer spent than practicing the skill. It allows for memory consolidation where the participant can think about how they have performed the action and continue to learn and develop the skill. Our program will entail 2 training sessions per week for 40 minutes that will be heavily interspersed with rest time and recovery. It is important to make sure that the client does not get bored with the way you are coaching and ensure that you keep the activities and training programs specific to the motor skill you are trying to learn. There should be a balance in high and low intensity sessions to not wear the client out and change the activities to focus on different components that make up the whole motor skill. This can be seen through our intervention with different activities taking place each week with a different focus. The intensity increases as the learner's proficiency does. By doing this, it enables the client to put their full attention into the skill and not get distracted or bored. In week 1, the learner can be seen to be in the cognitive stage due to the learner getting an idea of the basic movement requirements. In this stage, it is common to reformulate past movement experiences that are similar to the new skill. Errors will often be large and frequent during this stage. Demonstrating a skill to a learning participant is an effective way of showing how the skill should be performed. When demonstrating a skill, it should be done in real time first. Here the coach can be seen demonstrating how to correctly perform the free throw as the learner closely observes. Another way of communicating with the participant is through verbal cues. Verbal cues are small, concise phrases that are usually 1 or 2 words that are linked with the skill in order to communicate how to execute the skill. It helps to use verbal cues the participant is familiar with from previous school they have performed. For example, our participant has a background in athletics and could use the keywords or phrases such as follow through, full range of motion, bend the knees, and transfer them to the basketball free throw. Attention involves selectively focusing on one situation. Many factors influence attentional demands, i.e. the number of cues used and the level of skill. The proficiency of the learner also affects attention as novices will struggle to attend to more than one aspect simultaneously. Mental rehearsal is a type of attention called internal direction which was used in the first week. Memory involves the ability to effectively remember past experiences. During the initial stages of learning, both short and long-term memory considerations should be noted. For short-term memory, it must be noted that an individual novice only has the ability to store information for 20 to 30 seconds if the information isn't rehearsed. Again, during the first week of the program, in order to increase the short-term memory, practicing of the cues was repeatedly performed. Augmented feedback is the use of advice or criticism given via an external source, i.e. coach. It can come in the form of verbal feedback or by watching a video recording. These forms of feedback have been shown to enhance performance when learning a new motor skill. Knowledge of results is a way of augmented feedback that a learner can use when learning a new skill. However, this has been shown to regress the learner's proficiency when the feedback is taken away. In our intervention, we focused more on knowledge of performance using prescriptive feedback with a high frequency at the start and decreasing to ensure a dependency was not formed. In week 2, the learner moved into the associative stage, where they had understood the general idea of the movement. It is where the learner became committed to refining the movement pattern. In this stage, their performance became more consistent with fewer errors, and they had the ability to detect some of the errors and develop strategies to eliminate them. The learner used mental rehearsal as a practice tool.
I believe I can fly. I believe I can touch the sky.
In this week, we got the participant to use only their dominant hand to focus on the body movement and their arm positioning component of the shot. In week 3, the participant can still be seen as in the associative stage. They are still making mistakes, but far less than in weeks 1 and 2. In this week, the learner returned to the two-handed shot, requiring them to use their attention and memory from the first week, also utilising what they learnt in week 2. To make the training a little more difficult and keep the learner interested, we composed an activity where the learner took a shot from a close distance, and each time they were successful, they took a step back. In week 4, the learner progressed to the final stage, the autonomous stage of learning. In this stage, the learner made fewer mistakes, but more than that, they were able to detect the errors in their mistakes and correct them without assistance from the coach. To make it more complex for the learner, music was played in the background to distract them and make it more like a game situation.
Missing every shot I ever missed, and I remember still.
Again in week 5, the learner was in the autonomous stage, where they were confident, made few mistakes, and again was able to identify and correct their faults. As a transfer test, the learner was asked to carry out a series of short sprints before taking a shot, to mimic the fatigue in a game and test the learner's transfer proficiency. Our pre-test clearly shows the learner was a complete novice, only getting 4 out of 10 attempts in with only 2 swishes. On the majority of occasions, the learner did hit the ring, but it rebounded off and missed the shot. Post-test shows an improvement in both the results and the performance. 1 more swish was made, and 2 more goals overall were made. This time, most of the balls that hit the ring actually went in and scored a goal.
Come on!